schools being closed, events being canceled, and President Donald Trump declaring a national emergency over the coronavirus pandemic, I was so confused on what actually was happening with the virus. So I decided to ask a doctor. Let's start with the basics. What is the coronavirus?
Coronavirus is actually a common virus that we normally get and can cause colds. This special virus called COVID-19 is a virus that started in Wuhan back in December 2019, and it's spread to be a pandemic. And currently we're responding in the United States with about 1,600 cases now, and deaths that are continuing in about 40 to 50 deaths in the United States to this day, March 13th. So it's a virus that you can get through droplets, so coughing or touching doorknobs and surfaces and buttons. And right now there's no cure and there's no treatment, and they're currently working on trying to create a vaccine.
If a person sneezes or coughs around me, is it correct for me to react like this?
You want to be alert, but not necessarily overly alarmed. So anytime you hear someone sneeze, remember sneezing is upper respiratory. That's the nose, the face, the mouth. That's more probably going to be like a cold or allergies. COVID-19 is going to be more like a deep barking cough, a tightness in the chest, breathing issues. So if you see someone sneezing, I wouldn't automatically assume they have COVID-19. Sneezing is not really a primary symptom. Don't go crazy on somebody. Even if they're coughing, it could be many, many other things. Maybe they just swallowed something too quickly. So don't automatically assume that someone is infected. But at the same time, you may want to increase your distance away so that you maintain about a 6-foot distance if somebody's coughing.
How long does the coronavirus live? Like on your hands or your shirt or any type of surface?
There have been studies. They're looking into how long it can hover in the air, so I don't have any definitive numbers on that. But as far as living on a surface, the most recent study that I saw was that it was 2 to 3 days that it can live on a surface. So that could be a doorknob, that could be a desk, that could be a chair. That's why it's so important that we wash our hands, because you can accidentally come in contact, and somebody who coughed in that room it could have happened on Friday and you're getting there Monday morning, and you can still potentially pick up a germ from somebody from a weekend ago.
Will things like ginger ale, vitamin C, or a multivitamin help you to not contract the virus?
I know there's a common belief amongst us that ginger ale covers everything, but unfortunately ginger is very good for stomach issues. If you're feeling nauseated or you may want to vomit, ginger's fine. This is a virus and ginger ale is not going to handle that. There are multiple medical studies that have looked at vitamin C. There isn't any correlation between increasing vitamin C intake and decreasing your viral load, unfortunately. There are studies that look at vitamin D that say it may boost your immune system, but again, I would not strictly rely on a vitamin source to prevent getting it.
We don't know of any special vitamins or special cures that'll prevent you from getting this COVID-19 or treat it, but it's always a good idea to take really good care of your body.
Should I be out here Naomi Campbelling it?
So the CDC recommends that if you do not have any symptoms like coughing, sneezing, you should not wear a mask. If you are coughing, if you are sneezing, that doesn't necessarily mean you're infected with the coronavirus, but the mask will block your germs from spreading out into the room and infecting other people. However, if you're already well, there's a couple issues. One, there's not a lot of masks that are in circulation right now. There's somewhat of a shortage, so there's not enough masks to go around for every healthy person. Two, wearing a mask gives you another reason to want to touch your face. It's something that you're going to adjust. It's something that's there, and if your hands are contaminated, you're going to end up touching your face, and that's not what you need. You may inadvertently infect yourself because of your mask. And three, the type of mask that just has the ear loop that goes around the ears is not necessarily blocking anything from coming in the side, so you can still, if someone were to cough within 6 feet of you, you can still get some of that germ into your nose or into your mouth. There is moisture on the ear loop masks. As you're breathing in and out, your hot breath condenses onto the mask, and the moisture can actually make your mask a little bit more attractive and hold on to germs longer. And again, if you're adjusting said mask that is now infected, you could then spread the infection to your face. Gloves are fine, but be careful, because think of gloves as germ magnets. So it's protecting your hands, but your skin protects your hands too. So if you're gonna wear a glove, that's fine, but don't forget that you're wearing gloves, because whether you have dirty hands or dirty gloves, you don't want to touch your face. So it's easier to take the gloves off, but then you have to properly take the gloves off. If you don't know what you're doing, you're just taking a dirty glove and putting the germs on your wrist as you take off the other glove. So it could just be something else, another way to transmit germs to yourself. Just keep your hands clean.
So who's immune? Is there a certain race or demographic?
So there is a myth that is floating around that there aren't any black people that are being affected by this disease. As of today's date, we have had 2 NBA basketball players that have been confirmed to have COVID-19, or coronavirus, I'm sorry. They are black. Black people can get this. There is not any race that has been shown to be immune to this disease, so do not feel that you are a lower risk than anybody else because of the color of your skin.
Disappointing. So what exactly are you saying that I can do to not get the virus?
The best things you can do to prevent this virus right now: if you're not feeling well, stay away from other people. If you can, do not spread anything. If you can limit your exposure to large crowds or large groups of people, it's probably a good idea to do that. And absolutely number one above anything else is keep your hands clean and try to minimize how often you touch your face with your hands so that you don't end up infecting yourself.
Always make certain when you touch a doorknob or go to the automated teller or go to the grocery store, you always want to make sure that you hand sanitize after you touch a surface that's unfamiliar to you.
So hand sanitizer is not the number one thing.
Nothing's going to beat washing your hands with soap and water. But make sure any hand sanitizer you have, if you check the back, make sure it's at least 60% alcohol in there. That's going to help kill any disease, virus, germ, whatever.
How accurate is the testing at this time?
For all intents and purposes, any test, so the tests are 2 stages. There's an initial test that's done, and if it comes up positive, it's called a presumed positive. Then it has to be confirmed by the CDC, and they will look over it and determine that it is an actual confirmed case. These tests are handled by healthcare professionals that know what they're doing, so there is no reason to doubt the test. There have been tests that have been reported to have issues, but those were reported by the people that were administering the test. So again, the fact that you're being seen by a healthcare professional, you should rest assured that if they believe that you have it, you probably have it. So feel free to believe the diagnosis if you're confirmed to have it. But they will test for other things. Even the NBA player was tested for the flu first before they tested the coronavirus. So they're going to look at a number of different things, including your symptoms, to determine if you even are qualified to have the test given to you. And then if you do meet the qualifications, they will give you the test.
Should we be scared?
Absolutely not. So this is a virus, this is a pandemic, and these things happen in humanity, and they're going to continue to happen. But I think what's really important right now is to remember how to take good care of yourself and to try to take good care of your community by practicing this safe social distancing for a small amount of time, trying not to go out and spread the disease, trying not to spread it to grandma or to other people that might be vulnerable. It's really just to try to keep all of us safe, and,
That's right.
and we'll get through this.
That's right, we certainly will.
I guess the most important thing is to wash your hands. Soap and water, people. Until the next time, Ellie explains.